My name is Ashley Perkins, and I'm doing my case study on renal artery stenosis. So, a little introduction about renal artery stenosis. It is a narrowing of the arteries that carry blood to one or both of the kidneys. The renal arteries are responsible for carrying oxygen-rich blood to the kidneys, which helps the kidneys get rid of any extra waste in the body and excess fluid. Renal artery stenosis is often seen in either older adults with atherosclerosis or younger adults with fibromuscular dysplasia. It can worsen over time, and it often leads to hypertension as well as kidney damage if it's left untreated. There's a little picture right there kind of showing on the right a normal kidney, and on the left the renal artery stenosis with all of the plaque buildup through that artery. Over 90% of renal artery stenoses are caused by atherosclerosis. However, the remaining 10% are caused by the fibromuscular dysplasia. Renal artery stenosis is the most common cause of secondary hypertension, and that accounts for 1 to 3% of the causes of high blood pressure. So there is an overlap of renal artery stenosis with other atherosclerotic diseases. It has been recognized for a long time by physicians that if a patient has atherosclerotic disease in one arterial bed, it is likely that they have disease in another. One study I found through some articles I read said that 6.8% of elderly patients who enrolled in a cardiovascular health study had 60% or more of a stenosis or occlusion, which was determined by renal duplex ultrasound. And here's a little picture on this right-hand side showing stenosis of the kidney. So in young patients with fibromuscular dysplasia, typically the mid and distal renal artery is affected, and it's more commonly on the right. With patients with atherosclerosis, it's usually the proximal and origin of the renal artery that's affected. The prevalence of renal fibromuscular dysplasia is estimated at 4 per 1,000 of the population, although the true prevalence is probably considered very much higher. And FMD is also more common in the female population group. Again, on the right-hand side, an ultrasound showing the vessels showing vessel tortuosity and turbulent flow in the mid to distal main renal artery, which we kind of just talked about. That's consistent with patients who have fibromuscular dysplasia. So some signs and symptoms of renal artery stenosis is continued high blood pressure, and a key point here is despite taking medications to help lower it. A decreased kidney function, which is usually found through lab tests. Fluid retention, edema or swelling, especially in the ankles or feet. Again, the decreased or abnormal kidney function, and an increase of proteins in your urine. So going over the diagnosis, treatment, and prognosis for this disease. So labs help us to be able to determine the diagnosis. We look at the blood and urine tests to evaluate proper kidney function. Imaging, popular imaging is renal duplex sonography, which has an overall accuracy of 96%, which is pretty awesome. You can also order a CT scan or a renal arteriography or an MRA. Treatment can be starting out as medications such as diuretics. It can also lead to things a little more, I guess the word is severe, I guess, such as surgery, which would be renal angioplasty and stenting or renal artery bypass. Prognosis for this is if a patient comes in and they're left untreated, they will experience high blood pressure as well as kidney failure, which will require dialysis, surgery, and a kidney transplant. However, if it is treated, there is a high survival rate, improved blood pressure, and typically a very stable kidney function. So now going on to my case study here. So a 64-year-old man presents to the ER with a chief complaint of shortness of breath. He has a history of coronary artery disease and hypertension, and he is currently on diuretics. The patient states he has managed his blood pressure very well by taking his medication, but it's been elevated the past 4 months despite his efforts in keeping it low. So his systolic BP is 170 over the diastolic BP of 110. His urinalysis shows 1 plus protein, and his serum creatine levels is at 2.5, which are all very elevated and abnormal. So renal Doppler ultrasound is ordered. So ultrasound provides evidence for a bilateral renal artery stenosis for this patient, and a renal angiography confirms the diagnosis. And in this image, I love this image, this shows a bilateral renal artery stenosis. So kind of cool. Okay, so treatment for this, the physician orders a renal artery angioplasty and stent as it's the preferred method of treatment, especially at his age, his history, and showing the bilateral stenosis from the ultrasound. So what they do in this type of treatment, this image I thought shows a really good example of the process of it. So first, obviously, you can see the cholesterol and the plaque buildup in the artery. So then they insert a catheter with a balloon into the blocked artery, and then they inflate the balloon to like expand the stent, and then the balloon's removed and the stent is just left. That opens up the artery, you know, gets rid of the narrowing and helps blood flow more accurately. So the prognosis from this, the patient recovered as expected from the surgery, and he was released 24 hours after the catheter was removed. The patient was prescribed aspirin, which is a blood thinning drug, for 9 months following surgery. And a follow-up appointment is made 1 week following the surgery to examine the catheter insertion site is healing appropriately and there's no type of infection. And the patient was examined and good outcomes was expected. So a differential diagnosis for renal artery stenosis is acute kidney injury. Got a little picture showing that on the right. You can see the increased echogenicity of the cortical and the kidney size is enlarged. So acute kidney injury is a sudden experience of kidney failure or kidney damage that happens within a few hours or a few days. Typically, I think I read it's like 7 days. It causes a buildup of waste products in your blood and makes it difficult for the kidneys to do its job, basically manage the balance of fluid in the body. So that could be another differential diagnosis. Here's a couple of my peer-reviewed references, and then just my image references.